Now, this upward trend is why some people are concerned about going back to work. In fact, a few Houston restaurants have closed temporarily again because their employees tested positive for COVID-19. Now, this viewer reached out on Facebook to ask, what is the guidance for employers who have outbreaks within their company and are doing nothing to protect employees? You ask, and our Melissa Correa has the answer.
When it comes to questions about coronavirus and working in the office, the CDC, OSHA, the Department of Labor, and county health departments all play a role. The CDC recommends employers do these 5 things: daily health checks, like checking each employee's temperature, a hazard assessment of the workplace, encouraging workers to wear face coverings, practicing social distancing, and improving the building's ventilation system. If someone in the office gets the coronavirus, the CDC wants employers to close off all areas visited by that employee, open doors and windows to increase circulation, and wait 24 hours before cleaning the area with an EPA-approved disinfectant. Every surface, even carpets and curtains, should be cleaned. OSHA, which regulates workplace safety standards, wants employees to wash their hands frequently. OSHA wants employers to offer flexible work sites and flexible work hours. OSHA is discouraging workers from using shared spaces and equipment, and right now employers should not require sick employees to get a doctor's note. The pandemic is why the Department of Labor announced in April emergency paid sick leave. It covers up to 80 hours of paid leave if the employee or a member of their family contracts COVID-19. You can get tested for free in Houston, and if an employee is waiting on results, the Harris County Health Department wants them isolated while at work. And in the case of an outbreak, the county says employers should close temporarily. To learn more, go to khou.com and click on this story.